So you just had a baby and you're leaving the hospital. What are the things you need to know for the first couple days to get you through to your first pediatric appointment?
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
All right, good morning. We're back in the studio of Be Kind Pediatrics. Today, I want to talk a little bit about what I call the newborn 101s or baby boot camp. I think that for a lot of newborn parents, once you leave the hospital, that can be a very anxiety-provoking moment. And so these are kind of the top things I like to go over with parents so that they know when they go home how to continue caring for your baby when you leave the hospital. So the first topic I usually like to talk about is feeding. For breastfed babies, it can be a little hard to tell how much breast milk your baby is getting. So the most important way to know that your baby is getting enough breast milk is by their urine output or how many wet diapers they're making, what they look like after they feed, and kind of their behavior. So let's first talk about feeding behavior and feeding cues, and then we'll kind of move on to wet diapers. So feeding cues for babies can look like things we call rooting, where they put their finger to their mouth, looking side to side with their mouth gaping open. Next, they'll kind of start to become more agitated as they get more hungry, so they start to cry potentially or get stronger cries. It can be hard to breastfeed a baby when they're really upset and crying, so usually I recommend soothing them first, and we'll talk about how to do that later. So beyond feeding cues, the other thing you're looking for is when a baby has had a full feed, they will relax. Their hands will go from kind of tight clenched to open, and you'll see, kind of notice all of their muscle tone will become more relaxed. And that's a good sign that your baby has gotten a good, nice full feed. Over the course of 24 hours, you're looking for wet diapers as a hydration status, that they're getting enough breast milk. So in the first 24 hours, you're really looking for at least one wet diaper and potentially one stool. On the second day, you're looking for 2 to 3 wet diapers. On day 3 to 5, you're looking for 3 to 5 wet diapers. And then day 6, you're looking for 6 to 8 wet diapers a day. Stools, so again, the first day you want to see at least one bowel movement, potentially up to day 2, you want to see at least your first bowel movement. And then day 3 to 5, you're looking for at least 4 bowel movements a day. And then day 6 and on, some babies can have a bowel movement with almost every feed. Another nice way to tell is that baby stools usually start off as a dark, thick, tarry stool that we call meconium, and then they progress to a more yellow, seedy stool. And the reason for that is that newborn red blood cells don't have as long as a lifespan as adult red blood cells, so they only live about 90 days. And a breakdown of red blood cells is something called bilirubin. You might have heard of newborn jaundice. That's where bilirubin levels get high and their skin turns yellow. But the main way your body eliminates bilirubin is actually out through the stool. So you should see that your baby's stool becomes more yellow as they start to eliminate that bilirubin, and that's a good sign that they're also keeping up with their hydration. So the next kind of underratedly tricky thing is to tell, how do you actually tell when a newborn has had a wet diaper? Because newborns make actually very small amounts of urine, about 1 tablespoon. So I encourage you to kind of take half a tablespoon to a tablespoon and pour it in a wet diaper. And that will give you a good idea of the feeling or weight that 1 tablespoon of urine might add to a wet diaper. You might need to touch it, even smell it, even that sounds disgusting. And another way is I most often recommend that parents buy diapers that have wetness indicators. So this is like a little blue line on the diaper that shows when the diaper is wet. It can be a really helpful tool, especially for first-time parents. So I also often get questions from parents about the color of the urine. So newborn urine is almost actually completely colorless. And doesn't have a very strong smell at all. If your baby's urine is very yellow, if it has a odd or foul-smelling odor, those are reasons to contact your pediatrician. Another reason to call your pediatrician is if you notice any blood or dark red crystals in the urine. Sometimes when babies are dehydrated, they produce something called uric crystals, which look like little red brick crystals. That's a good reason to call them because it can be a sign of dehydration. Also, some babies can get blood in their diapers, and it can be benign or normal because When they're in the placenta, they're receiving quite a bit of estrogen transplacentally from their mother, and they actually go into a little bit of estrogen withdrawal, which can cause some bleeding in the diaper. But again, if you notice this, you should call your pediatrician, just let them know, so that they can check and make sure that nothing else is going on. Another kind of caveat 101 to newborn urine would be if your baby was circumcised in the hospital, you want to make sure that they have at least one wet diaper within 12 hours after the circumcision. So what are some signs that your baby is maybe not feeding well, besides that they're not making enough urine, or that they are not relaxed after feeds? So other signs can be if your baby is very sleepy. They might not be able to eat enough if they're sleeping all the time. So normal newborns will eat at least every 2 to 3 hours. If your baby is not waking up on their own after 4 hours to take a feed, that's another reason to call your doctor right away. And then the last kind of feeding section are what are things that you should call your doctor about right away if you notice. So if you notice that your baby is needing to be woken up after 4 hours to be fed, call your doctor. If their urine is really dark, foul smelling, if there's red dust crystals in there, if they're breathing fast, and anytime they have a temperature greater than 100.4 rectally, those are all reasons to call your doctor right away about feeding with your newborn. So to kind of piggyback off of wet diapers and urine amount, let's talk a little bit about diapering 101. So back in the day, we used to use baby powder in the diapers. We don't recommend that anymore. It actually causes some contact dermatitis. So the best thing you can use is any sort of petroleum-like jelly, something that's odorless, or natural coconut oil is another nice choice. You want to keep the skin with a nice thick barrier to prevent any stool or urine from irritating the skin. I recommend having newborn diapers that go below the umbilical cord. You don't want the diaper to cover the umbilical cord because that can cause urine to get on the umbilical cord, and you want to keep that area nice and dry and clean. You want to make sure that you have a good supply of the newborn diapers, but not a ton of them because babies outgrow them very quickly. And then you want to kind of know about the basic newborn diaper rashes. So newborn diaper rashes can look like red, angry. They can have some little, we call them satellite lesions that can be indicative of specifically a candidial diaper rash. Contact dermatitis tends to be more just flat, plain red. None of these are typically emergencies, but you should let your doctor know. Just send them a picture or bring them in, because sometimes we want to treat especially the candidial diaper rash with an anti-yeast medication like nystatin. And then kind of wiping, you always want to wipe front to back, especially in little girls, to prevent the potential for a urinary tract infection. So then let's kind of talk about the next one, which is bathing. I typically recommend that you do sponge baths for your baby. You do not want to submerge your baby in water, at least until their umbilical cord has fallen off. So until the umbilical cord falls off, you're just doing kind of wet rags or sponge baths. You want to use lukewarm or temperature warm water. Babies are very sensitive to warm water, so something that might feel comfortable to you and me might be actually feel too hot to your newborn. You can bathe them every day or up to, twice a week. They don't necessarily need to be bathed every day. You want to use a ointment-based lotion after you bathe them instead of a cream-based lotion because, again, that thick barrier ointment tends to lock in more moisture, and again, newborn baby skin is pretty sensitive. You want to use a shampoo that is unscented and has not a ton of ingredients in it. So I say take a look at the back of the label. It should be 5 or 6 ingredients, no more. And then the last kind of thing is you want to make sure you're washing really well behind the ears and in the neck area. A lot of formula can actually collect in these kinds of folds, and so you want to just be really mindful to those areas, paying special attention to use a wet washcloth behind the ears and in the neck area. You never want to put anything in your baby's ear like a Q-tip. You can just use, again, a warm washcloth and wash the inside and the outside. Anything bigger than your finger should not go in your baby's ear. So as we're kind of moving down from bathing, the next thing is how do you take care of an umbilical cord? So again, you want to keep it nice and dry and clean. You want to make sure always the diaper is below the umbilical cord. Other than that, you actually want to do nothing to it. Don't put any soap on it. Don't touch it. Certainly no alcohol or astringents. Just leave it alone. If you start to notice any redness, foul-smelling discharge, yellowness, pus, or pain when you seem to when you're touching the baby's belly, it seems to be in pain, those are all kind of urgent reasons to call your pediatrician right away. The umbilical cord will naturally fall off somewhere between 1 and 4 weeks of age. And then after that, you can start bathing your baby in a normal kind of baby bath. If your baby's umbilical cord does get wet, you just want to lightly pat it dry. So now let's kind of switch gears a little bit and talk about baby and newborn sleep. We could spend a whole episode talking about that, but let's just go over the very basics. So the first thing is that you want to choose a place for your baby to sleep that is safe. And what I mean by that is that they are in their own sleeping container, that the mattress is hard, that they are sleeping flat on their back always, and that there's nothing in the crib at all. So no pillows, no blankets, no stuffed animals. If you want a more co-sleeping type of environment, you can choose to have a bassinet that goes next to the bed, but that still has a separator between the baby's bassinet and the bed. Babies are very prone to overheating, so you want their sleep environment somewhere between 68 degrees and 72 degrees Fahrenheit. You want them just in a onesie and nothing else. You can do a onesie, and a swaddle, but nothing else. One common mistake that I often see is babies are sleeping with hats in their crib. That's a suffocation risk because the hat can move down as they move. So again, you just want a onesie plus or minus a swaddle. So that kind of moves into the next topic, which is soothing a newborn baby, of which a swaddle is one of the keys. So Dr. Harvey Karp kind of coined the term the 5 S's that help a parent soothe the newborn. And so the first one is the swaddle. Swaddling, it's really important to choose a swaddle that I recommend usually the Velcro ones because they're a little bit easier, but you want to choose a swaddle that keeps the baby's hands down at their sides, but that their hips are open and free to move. Swaddling a baby tight, like wrapping them almost like a mummy on a board, can cause congenital hip dysplasia. So you want to make sure that the hips have some freedom to move and the top is nice and snug. Really, the point of the swaddle is to prevent the Moro reflex or the startle reflex, where the baby is kind of go like this. And so you just need to have their hands down at their sides straight like that to prevent it. So once you have the baby nice and swaddled, the next part of the 5 S's is moving the baby into a side-lying position, having them kind of held to the side. So you can hold the baby on the side, but it's important to note this is really only safe for a holding position. When you put them down to sleep, again, you want them on their back in a flat, empty surface. The third S is shushing. So the thought behind this, or the theory behind it, is that when babies are in the uterus, they hear the uterine artery, which sounds a lot like shh, 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 and that they find that noise comforting. So once you get them swaddled, get them in the side-lying position, then you want to start shushing them kind of gently. This is also the kind of reason why white noise tends to be effective, because when babies are in the uterus, they're actually hearing a lot of noise transmitted through the placenta. And so total silence is not quite natural for them yet. So then the fourth S is going to be swinging. So either gently rocking the baby side to side. You'll notice the snoo kind of goes like this and rocks them side to side. There's pretty good research to show that rocking improves sleep latency, so the time it takes a newborn to fall asleep, and improve sleep quality for them. And then the fifth S is sucking. So you can use a pacifier to do this. If you're breastfeeding, you might actually want to wait a couple weeks to introduce the pacifier, but if you're not breastfeeding, it can be a really great soothing tool. So once you have the baby swaddled in side-lying position, you've started shushing them, you're swinging or rocking them, the last thing you want to do is pop that pacifier in. I recommend for most babies, if you are using a pacifier for soothing, that you use it for just soothing. So once the baby is calm and quiet, you take the pacifier out. Or if they fall asleep, kind of gently pull it out without startling them awake. There's 2 reasons really to do this. One, if you pacify a baby too much with a pacifier, sometimes you can miss important feeding cues, especially if you're breastfeeding, and that might lead to decreased milk production. And 2, later on when your baby gets older, sometimes when the pacifier falls out, it actually wakes babies up. So if you can gently start to get them used to using the pacifier just for soothing, but taking it out when it's not needed, that can help with their teeth, but also their sleep quality later on. So the next topic I usually talk about with parents is tummy time. So you can start tummy time from the day that you leave the hospital. It doesn't need to be more than a few seconds. So the way that you can do this is you put a hard mat down on the ground something that's not so soft that the baby's face is up against the mouth, and you let them have a few seconds on their belly. Most newborns aren't going to tolerate more than a few seconds of this, but the important thing is to get them used to it and start gradually increasing every week, a couple more seconds each session. Tummy time can occur in multiple ways. So it can be when they're on the floor on a mat, but it can also be tummy to tummy with mom. Or it can also be when you have your baby in a baby carrier, anything where they are using and strengthening their neck muscles and their upper body muscles. And the importance of this is, one, you want to prevent positional plagiocephaly. You can look at our other video to kind of review that topic. But two, to really start developing the neck muscles and the upper body muscles so that they can start learning to sit up, which will be their next major gross motor milestone. So to kind of go along with breastfeeding as well as tummy time, another topic that I like to talk about with parents is how to manage newborn gas. So newborns don't really have the abdominal strength to get gas out of their bellies, so it can cause them to be a little bit fussy. So there's a few things you can really do to prevent newborn gas or to help it once it occurs. One is burping. I really like this position where the baby is kind of sitting upright and you gently support their neck and pat them on the back and let their tummy kind of squish the gas out. You can also do it over your shoulder or lay them flat on your legs and put a little pressure on their bellies. If your baby doesn't burp within a couple seconds, just move on. Babies are not going to burp every time you feed them. You try for a couple seconds and then again you move on. You don't want to be excessively burping a baby throughout feeds, because actually every time you take them off the breast or away from the bottle, they inhale more air, which is called aerophagia, and can actually worsen gas paradoxically. So you do this once, maybe at the end of the feed or mid-feed, and if they don't burp, again, just move on from it. If you're noticing they're still having a lot of gas after that, you can do something called the baby belly massage, where you gently start. I like to start in the right lower quadrant, go to the right upper quadrant, left upper quadrant, and then left lower quadrant. And the massage is really nice because A, it helps with the gas, but also massage has been shown to improve infant sleep and infant parental bonding. So it kind of has three great benefits to it. And so even if your baby doesn't have gas, I usually recommend incorporating some sort of infant massage into their nighttime routine. So another great topic to talk about when you're bringing your baby home is nail care. So I recommend that you file your baby's nails. I don't ever recommend that you use a clipper because babies move, they're really squirmy, and their nails are really small. And I've seen a few times where a parent accidentally nicks the tip of the finger. So an infant file is a really nice, safe way to just kind of keep them filed down, because babies tend to scratch their faces if their nails kind of aren't kept trim. You can do baby mittens as well to prevent them from scratching their face, but I prefer not to use mittens because actually it's really nice developmental exercise for them to feel their face and be reaching around with their hands. So I don't like to cover up that sensory input for them, and that's why I prefer a nail file. And so the last thing I kind of want to briefly talk about is bottle feeding. And so I recommend that even if you're planning to breastfeed, that you have a few bottles around at the very beginning that you've selected and like, because not every baby is going to take to the same bottle the same way. So have a few different shaped nipples, a few different shaped bottles, some wide ones, some wide mouth bottles, some thin mouth bottles, and let your baby kind of guide you as to which bottle they naturally have a preference for. Bottles will have different flow nipples. So for newborn, you want to start off with a slower flow. They typically can't handle a fast flow nipple quite yet, but have a few and make sure the nipples are slow flow. And if your baby seems to not have a particularly agreeable with one bottle, just try switching to a different one and see how it goes. If you've gone through one or two bottles and you're still hitting a roadblock, definitely reach out to your pediatrician and have them assist you with further steps in bottle feeding. So this was kind of a really quick and brief overview of a bunch of topics that I hope you find helpful if you're just coming home with your baby. If you have any particular questions or comments, please leave them below, or any other future topics you'd like reviewed in this area.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.